4, Boston, Massachusetts. On Friday, 4 days after the catastrophic fugue that followed the aortograft on Viola Fletcher, Ginger Weiss was still a patient at Memorial Hospital, where she had been admitted after George Hanneby led her out of the snowy alleyway in which she had regained consciousness. For 3 days, they had put her through exhaustive tests, an EEG study, cranial x-rays, sonograms, pneumoventriculography, a lumbar puncture, an angiogram, and more, repeating these several procedures, parentheses, though fortunately not the lumbar puncture, close parentheses, for cross-check results. With the sophisticated tools and processes of modern medicine, they searched her brain tissue for neoplasms, cystic masses, abscesses, clots, aneurysms, and benign gummatous lumps. For a while, they concentrated on the possibility of malignancies of the perineural nerves. They checked for chronic intracranial pressure. They analyzed the fluid from the spinal tap in search of abnormal protein, cerebral bleeding, a low sugar count that would indicate bacterial infection, or signs of a fungus infection. Because they were physicians who always gave their best to a patient, but especially because Ginger was one of their own colleagues, her doctors were diligent, determined, thoughtful, thorough, and firmly committed to pinpointing the cause of her problem. At 2 o'clock Friday afternoon, George Hanneby came to her room with the results of the final battery of tests, and with the reports of consultants who had given one last round of opinions. The fact that he had come himself rather than let the oncologist or the brain specialist, parentheses, who were in charge of her case, close parentheses, bring the news, most likely meant that it was bad, and for once Ginger was sorry to see him. She was sitting in bed, dressed in blue pajamas that Rita Hanneby, George's wife, had been kind enough to fetch, along with a suitcase full of other necessities, from the Beacon Hill apartment. She was reading a paperback mystery, pretending to be confident that her seizures were the result of some easily corrected malady, but she was scared. But what George had to tell her was so bad that she could no longer hold fast to her composure. In a way, it was worse than anything for which she had prepared herself. They had found nothing. No disease, no injury, no congenital defect, nothing. As George solemnly outlined the final results and made it clear that her wild flights performed in a fugue were without a discernible pathological cause, she finally lost control of her emotions for the first time since she had broken into tears in the alleyway. She wept, not noisily, not copiously, but quietly and with enormous anguish. A physical ailment might have been correctable, and once cured, it would not have prevented her from returning to a career as a surgeon. But the test results and the opinions of the specialists all conveyed the same unbearable message. Her problem was entirely in her mind, a psychological illness beyond the reach of surgery, antibiotics, or controlling drugs. When a patient suffered repeated incidents of fugue for which no physiological cause could be found, the only hope of ending the seizures was psychotherapy, though the finest psychiatrists could not boast of a high cure rate with patients thus afflicted. Indeed, a fugue was often an indication of incipient schizophrenia. Her chances of managing her condition and living a normal life were small. Her chances of institutionalization were dismayingly high. Within reach of her lifelong dream, within months of beginning her own surgical practice, her life had been shattered as thoroughly as a crystal goblet struck by a bullet. Even if her condition was not that extreme, even if psychotherapy gave her a chance to control her strange outbursts, she'd never be able to obtain a license to practice medicine. George plucked several Kleenex from the box on the nightstand and gave them to her. He poured a glass of water. He got a Valium and made her take it, though at first she resisted. He held her hand, which seemed like that of a very small girl when clasped in his large mitt. He spoke softly, reassuringly. Gradually he calmed her. When she could speak, she said, "But George, damn it, I wasn't raised in a psychologically destructive atmosphere. Our home was happy, at peace. And I certainly got more than my share of love and affection. I wasn't physically, mentally, or emotionally abused." She angrily snatched a box of tissues from the nightstand, tore Kleenex from it. "Why me? How could I, coming from my background, develop a psychosis? How? With my fantastic mother, my special papa, my damned if it wasn't happy childhood, how could I wind up seriously mentally disturbed? It isn't fair, it isn't right, it isn't even believable." He sat on the edge of her bed, and he was so tall that he still loomed over her. "First of all, doctor, the consulting specialists tell me there's a whole school of thought that says many mental illnesses are the result of subtle chemical changes in the body, in the brain tissue, changes we're not yet advanced enough to detect or understand. So this doesn't have to mean that you're screwed up by your childhood. I don't think you've got to reevaluate your whole life because of this. Second, I'm not, I repeat not, at all convinced that your condition is anything as serious as debilitating psychosis." "Oh, George, please don't coddle a patient. Me," he said, as if no one had ever suggested anything half as astonishing to him. "I'm not just trying to lift your spirits. I mean what I say. Sure, we didn't find a physical cause for this, but that doesn't mean there isn't a physical problem involved. You might have a condition that's not yet sufficiently advanced to be detectable. In a couple of weeks or a month, or as soon as there's any worsening of the problem, any indication of deterioration, we'll run more tests, we'll take another look, and I'd bet everything I own that we'll eventually put our finger on the problem." She allowed herself to hope. Discarding a wadded mass of tissue, she fumbled for the Kleenex box. "You really think it could be like that? A brain tumor or an abscess so small it doesn't show up yet?" "Sure. I find that a hell of a lot easier to believe than that you're psychologically disturbed. You're one of the steadiest people I've ever known, and I can accept that you could be psychotic or even psychoneurotic and not exhibit unusual behavior between these fugues. I mean, serious mental illness isn't expressed in neatly contained little bursts. It slops over into the patient's entire life." She had not thought about that before. As she considered his point, she felt a little better, though not wildly hopeful and certainly not happy. On the one hand, it seemed weird to be hoping for a brain tumor, but a tumor could be excised, perhaps without gross damage to cerebral tissues. Madness, however, responded to no scalpel. "The next few weeks or months are probably going to be the most difficult of your life," he said. "The waiting. I suppose I'm restricted from hospital work for the duration?" "Yes, but depending on how you come along, I don't see why you can't help me out at the office." "And what if I threw one of these fits?" "I'd be there to keep you from hurting yourself until it passed." "But what would your patients think? Wouldn't exactly help your practice any, would it, to have an assistant who suddenly turns into a Meshuggah and runs shrieking through the office?" He smiled. "Let me worry about what my patients think. Anyway, that's for the future. Right now, at least for a week or two, you've got to take it easy. No work at all. Relax. Rest. These last few days have been emotionally and physically exhausting." "I've been in bed. Exhausting? Don't knock a teapot." He blinked, confused. "Don't what?" "Oh," she said, surprised to have heard those 4 words pop out of her. "Something my father used to say. It's a Yiddish expression. Hock niet kein schniek. Don't knock a teapot. It means don't talk nonsense. But don't ask me why it means that. It's just something I used to hear all the time when I was a kid." "Well, I'm not knocking a teapot," he said. "You may have been in bed all week, but it's been an exhausting experience nonetheless, and you need to take it easy for a while. I want you to move in with Rita and me for the next few weeks." "What? Oh, I couldn't impose on you." It's no imposition. We have a live-in maid, so you won't even have to make your bed in the morning. From the guest room window, you'll have a nice view of the bay. Living around water is calming. In fact, it's quite literally what the doctor ordered. No, really, thank you, but I couldn't. He frowned. You don't understand. I'm not just your boss, but your doctor, and I'm telling you this is what you're going to do. I'll be perfectly fine at the apartment. No, he said firmly. Think about it. Suppose one of these seizures struck while you were making dinner. Suppose you knocked over a pot on the stove. It could start a fire, and you might not even be aware of it until you came out of the fugue, by which time the whole apartment could be ablaze and you could be trapped. That's only one way you might hurt yourself. I can think of 100, so I have to insist that for a while you must not live alone. If you don't want to stay with me and Rita, do you have relatives who'd take you in for a while? Not in Boston. In New York I've got aunts, uncles. But Ginger could not stay with any of her relatives. They would be happy to have her, of course, especially Aunt Francine or Aunt Rachel. However, she did not want them to see her in her current condition, and the thought of pitching a fit in front of them was intolerable. She could almost see Francine and Rachel huddling over a kitchen table, speaking in low voices, clucking their tongues. Where did Jacob and Anna go wrong? Did they push her too hard? Anna always pushed her too hard, and after Anna died, Jacob relied on the girl too much. She had to take over the house at 12. It was too much for her. Too much pressure, too young. Ginger would receive considerable compassion, understanding, and love from them, but at the risk of sullying the memory of her parents, a memory she was determined to honor always. To George, who still sat upon the edge of the bed and awaited her response, with an obvious concern that touched her deeply, she said, I'll take the guest room with the view of the bay. Splendid. Though I think it's a horrible imposition, and I warn you, if I really like it there, you might never get rid of me. You'll know you're in trouble if you come home someday, and I've hired people to repaint the walls and hang new drapes. He grinned. At the first mention of painters or draperies, we'll throw your butt out in the street. He kissed her lightly on the cheek, got up from the edge of the bed, and walked to the door. I'm going to start the release procedures now, so you should be out of here in 2 hours. I'll call Rita and have her come pick you up. I'm sure you can beat this thing, Ginger, but you've got to keep thinking positive. When he left the room and his footsteps faded down the hall, she stopped struggling to maintain her smile, and it collapsed instantly. She leaned back against her pillows and stared morosely at the age-yellowed acoustic tile on the ceiling. After a while, she got out of bed and went into the adjoining bathroom, where she approached the sink with trepidation. After a brief hesitation, she turned on the water and watched it whirling around and into the drain. On Monday, at the surgical scrub sink, after successfully performing the aortal graft on Viola Fletcher, Ginger had been panicked by the sight of water swirling into a drain, but she could not imagine why. Damn it, why? She desperately wanted to understand. Papa, she thought, I wished you were alive, here to listen, to help. Life's nasty surprises had been the subject of one of Papa's little sayings that Ginger had once found amusing. When anyone fretted about the future, Jacob would shake his head and wink and say, Why worry about tomorrow? Who knows what'll hit you today? How true, and how utterly unamusing now. She felt like an invalid. She felt lost. It was Friday, December 6th.